Assalamu alaikum. Today we will discuss the short overview of the anatomy practical OSPE regarding bones. We have different types of bones as you have already studied in the general anatomy. We have some flat bones such as sternum, skull bone, scapula, ribs and clavicle. Some irregular bones, for example vertebrae and hip bone. And the long bones which you can see in this diagram, humerus, tibia, femur and the fibula. Then we have the short bones which are the bones of the hand and the feet, which are carpals and the tarsals. Then the sesamoid, which is the patella. So we have the bones of the axial skeleton as well as some bones of the appendicular skeleton. Bones of the axial skeleton are the skull, vertebral column, sternum and the ribs, while bones of the appendicular skeleton are upper limb bones, pectoral girdle, pelvic girdle and the lower limb. Bones of the axial skeleton, where we will firstly discuss the skull. We have different bones which are some paired and some are unpaired bones. So the frontal bone, which is unpaired bone, it is 1 in number and it is a type of flat bone as you can see in the first diagram. Second is the occipital bone. It is also a unpaired bone which is come under the category of the irregular bone, and this is also 1 in number. So the parietal and the temporal bones are the paired bones, so these are 2 in number, and these in this parietal bone is the flat bone while the temporal bone are the irregular bone as you can see in these diagrams. Then we have in the bones of the axial skeleton we have the sternum, which have the following parts as you can see: manubrium, body and the xiphoid process. This is also a flat bone. Then we have the ribs as you can appreciate in this diagram. These are 12 in number. True ribs are the 1 to 7 ribs. False ribs are 8 and to 10. While the floating ribs are the 11 and 12. And they come also under the category of the flat bones. Then we have the bones of the appendicular skeleton, in which we will discuss the pectoral girdle. Pectoral girdle is formed by the scapula and the clavicle. As you can see in the upper diagram, this is the scapula, which is a flat bone. It is a bone in the pectoral girdle. Then we have the clavicle. It is a bone in the pectoral girdle and it is a type of the long bone. This is surprising that clavicle is a small in size, but it comes under the category of the long bone because it has the 2 ends and a shaft, and its shape is like a S shaped. Then we have the bones of the appendicular skeleton, which forms the upper limb, where we have the humerus, which is responsible for the formation of the shoulder joint with the scapula, and you can appreciate with the black arrow the head. It is also a type of long bone. Then other bones of the upper limb are the radius and the ulna. Both are the long bones, and the radius is located laterally while the ulna is located medially. Then we have the bones of the lower limb, in which we have the femur and the patella. Femur is the bone of the thigh and it is a type of the long bone. You can see here that it has a upper end, lower end and the shaft, which are the properties of a long bone. And you can also see here with the arrowhead the head with the neck. So then is the patella. Patella is also known as the kneecap, and it is a type of the sesamoid bone. Then we have the bones of the lower limb, which also come under the category of the appendicular skeleton. Here we have the tibia, which is a long bone and located on the medial side of the leg, and the fibula, which is also a long bone and it is located on the lateral side of the leg. Fibula is a very weak bone and commonly fractures occur on fibula. These are the bones of the appendicular skeleton, where they form the bones of the hand and the foot. The bones of the hand are, as you can see here, the carpals, which are 8 in numbers, then metacarpals, which are 5 in number, and the phalanges, which are 4 in number. Then we have the bones of the foot, where we have tarsals 7 in number, metatarsals 5 in number, and the phalanges, these are 14 in number. You should know these bones and their names, as we can ask in the x-rays or ospe. So this was all about the anatomy practical ospe. Thank you.